Hello, everybody. I'm very happy to be here today with you all for this webinar around European Health Union organized by Center for Innovation in Medicine, InnoMed. My name is Mario Chanta. I'm the founder of the Center for Innovation in Medicine. We are a not-for-profit organization highly involved in European policies, European research and innovation, and implementation research projects. We're very interested in the topics around European health for many, many years. It was really great to see a lot of developments in the last decade, in particular in the last 5 years at European level, around different topics, Europe's Beating Cancer Plan, Cancer Mission, Healthier Together initiatives, European Health Data Space, EU AI Act, and other big European initiatives. And we will discuss about all of this today. I think this webinar is really timely because the new commission actually just started 5 days ago to work, and we very much looking forward to see how this European health agenda will be implemented by the new commission. And on another side, is for the first time, 2 days ago, EU Council put forward recommendation on cardiovascular health for the first time. And this is really, really important. I already anticipated the topics for our discussion today around cancer, around cardiovascular health, following, of course, some transversal topics from citizen engagement, stakeholders' involvement, digital transformation, European health data space, and potential influence of artificial intelligence. I'm very happy to be here today with 3 distinguished speakers, and I will start with Penilla Gunther, who is part of the Cancer Mission board, as well with Jeliazko Arabadjiev. Thank you so much for joining us today, and Teresa López Fernández, who is in charge with the Cardio-Oncology working group at the European Society of Cardiology. So I think we have a great representation from both cancer and cardiovascular health, cardiovascular diseases, to discuss from an European perspective. I will stop the introduction here, and I will actually invite you, and I will start with you, Penilla, and then Teresa and Jeliazko, to say a few words about yourself, your activities, and your interest on European Health Union.
Thank you so much for the invitation. I'm a former member of parliament in Sweden, so policy issues is very important for me to see also that what the European level decides also gets implemented in the different member states. So being a part of the Cancer Mission board is really something I think is very wise and very interesting, to have. And if there will be a cardiovascular health plan, as you said, Marius, there was a decision in the European Council the other day, or at least a proposal to create that. I think we also need to see that it's not easy to handle, health issues at European level sometimes, because it used to be only at the member state level or the national level. So I think to work more overarching, as I am doing, also involved in cardiovascular diseases, as well as health systems and so on, pharmaceutical legislation and all kind of things at the European level. I think it's so interesting that we now have this European health actually to help also the member states to create something that they might need help to do, or at least to have a collaboration about. So I believe in the European level, together with all the member states, that they can create something together that is beneficial for the citizens. I'll stop there.
Thank you, Penilla. You already opened some avenues for our discussion. Thank you so much, Teresa.
Thank you, Marius. Thank you for the invitation of being part of this very interesting webinar. As you told our audience, I'm cardiologist in Madrid at López University Hospital, and my main focus now is cardio-oncology. And cardio-oncology is really a rising subspecialty that, as you know, combine the cardiovascular care and the optimal cancer care for our patients. So to have a new European Cardiovascular Health Plan is really an amazing opportunity to really increase our collaboration with the European Cancer Beating Plan, because cancer and cardiovascular diseases are the most important cause of death in Europe. Indeed, cardiovascular diseases cause 37% of deaths in the European Union. And this is not just because of, let's say, cardiovascular diseases, it's because patients with cancer, patients who survive cancer, have a really increased risk of developing cardiovascular diseases. And most of these cardiovascular toxicities or cardiovascular problems that patients with cancer develop during and after cancer treatment can be prevented. Can be prevented if we are really able to combine our expertise in both areas and to work together. And as Penilla told us, I think that the European Union is really the right place to start these conversations, to raise awareness of the problem, and to drive innovative strategies to implement cardiovascular prevention in Europe, but also in patients with cancer, because in general, or at least the old strategies at some point ignore patients with cancer when we talk about cardiovascular health. And it's a really important part of the cancer treatment, to be aware and to promote healthy habits during and after cancer treatment.
Thank you, Teresa. Jeliazko, we're moving from cardiovascular diseases to cancer.
Thank you very much, Marius. It's a huge pleasure, big honor for me to receive invitation for this webinar, and mostly to partner with these distinguished two ladies and yourself as well. I'm Jeliazko Arabadjiev from Bulgaria. I'm a medical oncologist by training. Current board of the Mission on Cancer member. Also, I'm president of Bulgarian Scientific Society of Immuno-Oncology, and it perfectly fits to all of what has been said so far. First of all, congratulations to cardiologists who actually following the steps of oncologists who insisted and created with the blessing of DG Santent, Commissioner, Health Commissioner at that time, Stella Kyriakidis, introduction of European Beating Cancer Plan in 2021. A lot has been done since then, but this is probably the most organized document on cancer created ever within the European Union. And now, 4 years later, we see that the other major health problem at European level, cardiovascular diseases, adopted the same approach. What they're lacking now is having mission on cardiovascular diseases, but I believe it will come soon because the mission approach fits perfectly and goes alongside perfectly with the beating any disease plan, let's say this way. Another excellent synergy is between me and Penilla. I'm a perfect addition to Penilla experience, being a politician, being a policy maker, being a patient survivor and patient advocate, because I bring a little bit of my expertise as a medical oncologist. I bring doctor's perspective, And that's why we are a perfect couple with Penilla in every aspect. So in this particular call, in this particular webinar, I believe that we'll present all sides of the problem of cancer from European Beating Cancer Plan perspective, from mission perspective, and with conjunction with the topic of today called its European Health Union. Thank you.
Thank you, Jeliazko. Indeed, we'll have time to deep dive into the cancer mission and in general in the mission concept. I think this is so relevant, not just for cancer, but for cardiovascular health and in general, as you mentioned, for different diseases. And we'll start this discussion in a few minutes. But first, I would like to ask you, Teresa, because we have the mission for almost 5 years, and as well the Europe's Beating Cancer Plan, with all the developments in terms of policy. Penilla, you mentioned how important is this European initiative, in influencing what is happening at the national level. But how did you perceive this movement in the cancer field from where you are sitting in, not maybe in the center of this? You are connected because you are a cardio-oncologist expert. How is the perception coming from your side on all these developments in the European cancer policy, cancer field?
Yeah, thank you. It's a very important question. So as you all know, cancer and cardiovascular diseases are bidirectionally connected. So we know, and I want to start just explaining this, we know that some cancer treatments can lead to cardiovascular problems during or after cancer therapy. And we also know how to prevent these problems. So we really need to find the right strategies to be able to prevent. So we need to increase the prevention of cardiotoxicity. And also in the other side, we know that at least 53 million of people live with cardiovascular diseases in Europe. And 20% of this population is going to develop cancer because cancer is more common in patients with cardiovascular diseases. And these patients with cardiovascular diseases that develop cancer are at high risk of cardiovascular toxicity. So we need to be even more proactive in prevent cardiotoxicity and in implement optimal cardiovascular care. So with these two big problems, the main challenges we face is that because new cancer drugs come very early to the market to improve patients' life, we really need to regulate at European level how to understand the cardiovascular problems that we need to deal with. Because the cancer drug development is so amazing, but also so quickly that in general, monitoring of cardiovascular side effect is behind the implementation of these new cancer drugs in clinical practice. So one of the first challenges we face is we really need to work together in the development of new drugs because we really need these drugs to cure cancer or to chronify cancer diseases, but we need to be sure at the same time that we are able to protect patients to minimize the risk of cancer treatment interruptions. So is it true that cardio-oncology strategies are more and more well developed across Europe, but we still need a lot of education and a lot of institutional support because is another way to work. We really need to work on multidisciplinary team. We cannot work in silos. We cannot work in the cardiology department or in the oncology or hematology department. We really need to connect people from the basis to the European Union and the opposite, from the European Union to clinical oncologists and clinical cardiologists to really organize a comprehensive monitoring of patients who are at risk of developing cardiovascular problems during cancer treatment. And as you mentioned before, we also want to discuss a little bit on the role of artificial intelligence or new technical tools to improve this situation. And we really think at the ESC Council level that if we work on strategies that help us to predict risk partner, having or collecting big data, we are going to be able to detect those patients who are really at risk of developing cardiovascular problem, and therefore we are going to be able to organize comprehensive monitoring for these patients.
Thank you very much again. Multiple points to be discussed, but I will continue this way. One of the learnings from our projects we are part of on cancer, but as well on cardiovascular diseases, is that if you start working with the citizens or with the patients, let's say on cancer, there is a big probability actually to identify people who have cardiovascular diseases as well. So and vice versa. So the number of people living with multiple long-term conditions is actually very high. And if, let's say from a policy perspective, we are now discussing about Europe's Beating Cancer Plan and potentially a cardiovascular health plan and other initiatives, in practice, actually, patients might suffer from both diseases, or autoimmune diseases and so on. So your point of collaboration, of coming together in multidisciplinary teams makes absolutely sense. And this was one of the learnings. And this type of learning from our perspective wasn't possible without having this mission mindset. In other words, really putting in the center the citizens and the patients, being able to understand their needs, the current situation, and then in addressing this the needs to be able to include all the relevant stakeholders and so on. And speaking about the learnings, I will invite you, Penilla, maybe to explain a bit about the Cancer Mission. Then I'll invite you, Jeliazko, to continue, and as well to identify early learnings, some maybe best practices from different projects who are now implementing the Cancer Mission, and then to discuss how we can build on top of this best practice. So, Penilla.
Yes, thank you. I think the Europe's Beating Cancer Plan is one pillar, and the Cancer Mission is the other one. So they have, in some way, different missions, so to say, but they are very well connected, because the Cancer Mission Board are also looking at, of course, the projects which are managed by the Horizon program. And that's one of the things I would like to highlight, that the success with Europe's Beating Cancer Plan and related projects, that you can have funding for collaboration. I think that has really been a major cause of the progress of reaching the goals of the Europe's Beating Cancer Plan. Because without financing, sometimes you need to have also projects to discover new things, but you can also need the money because you need to discover collaboration efforts already done, maybe that you can discover together, or also for the future. I think one major thing that might not depending on Horizon program all the way, but the ECHOs, the establishment of Cancer Mission hubs has also created a lot of other projects and collaborations all over the countries. And I think to to create a cancer mission hub in each country to really make the first goal of the EU Cancer Plan, which is understanding. I think it's brilliant, actually, because understanding is not only for researchers or healthcare professionals, etc. It's for common citizens to know more about cancer and related also conditions, as we are talking about cardio-oncology, which I think I applaud actually all professionals who are seeing the connection between different kind of well-known diseases in a way, but the connection and how they can create also new diagnosis, which has not been able to, be discovered before, or at least acknowledged, I think. And if I may share, Marius, a bit of my own story, is that I really, think that I had cancer when I was very young. And 15 years after my treatment, I got a severe heart failure. And no one could know why. Because I didn't smoke, I didn't drink, I am quite small, no obvious reasons for this heart failure. But they discovered after a while that it might have to be with the relation with my earlier treatment was very tough. And I think my heart was quite weakened by that treatment. But to know that at that time, I had no idea that it could be like that. And I think to just inform and to educate and to train both citizens as well as healthcare professionals about the connections, and to remind patients sometimes also when they come to the doctor and have some kind of pain or other issues, to ask also, have you had a cancer treatment before? So I think the Cancer Mission is more than just to look for projects around the Horizon programs or reach the goals, because we are also, as ambassadors, traveling around the countries and meeting as well ordinary citizens as well as organizations and governments and healthcare professionals, etc., and to know what can we do for you, and what can we do together. So to create networks is also really, really important, I think, to reach the goals. And I think Jeliazko has a more fact-inspired explanation, maybe. But I think, as you said, Jeliazko, we're a perfect match.
So the floor is yours.
Yeah, absolutely. Thank you very much, Penilla. It's always difficult to speak after you because you cover the entirety of the problem every time you speak. Well, so just a few points which I would like to add to what Penilla said, and briefly making a transition to Teresa's talk about cardio-oncology and cardiovascular complications of cancer treatment. So first of all, I'm really happy that I'm part of the mission. I'm working within the board with these brilliant people I work with there. But I'm even more happier because this is probably the best and the most structured approach to the complexity of the cancer. Because as a medical oncologist, before I joined this structure, before I joined the board and the mission, I was only focused on the medical problem. And the medical problem is cancer treatment, and survival, let's say this way. It's a pretty focused approach. Thanks to the mission approach, we consider cancer as a more general problem. I see it from patient eyes. I see the cancer problem from citizens' eyes, because mission approach gives you this opportunity, because we put citizens including those who are taking care of patients with cancer, into the focus of the mission. The other major thing for me within the mission is that the mission is laid on the fundament called knowledge, because this is the slight difference with the European Beating Cancer Plan, because the European Beating Cancer Plan is focused on particular actions, particular flagship initiatives, let's say this way. There are 10, if I remember correctly. But on the other hand, the mission on cancer objectives are built, the pillars of mission on cancer are built over a fundamental knowledge. So the mission encouraged and put a lot of efforts to broaden the knowledge through innovation. And this is the missing part of the whole concept, of the whole perspective of cancer, innovations. And I'm making a transition to what the cardiologist said. It's very important to stress on innovations in your cardiovascular health plan, because only through innovations, Teresa, only through innovations, you will change probably the incidence level of cardiovascular disease, and you will put more efficacy of what are the current measures against cardiovascular disease, and reducing the burden of this disease. Obviously, it's pretty high at the European level. And the last but not least, the benefit of the mission is raising the European awareness for cancer and for cardiovascular disease nowadays, because only the European awareness matters much to national governments, to national institutions. At least it means for our countries, for Romania, Bulgaria, the Balkan region, we very much rely and very much praise signals coming from Brussels, from the Union itself. We are a little bit not very how to say, not very sure people here within the region, and we very much rely on good practices, good signals, good initiatives coming from the European level. So, put in a nutshell, the mission on cancer, together with the European Beating Plan, is raising the cancer awareness and probably cardiovascular disease awareness, and it will it will accelerate national initiatives through funding from European programs. Thank you.
Just to add, Jeliazko, to your last point, indeed, we wait maybe 2 years after the Europe's Beating Cancer Plan to be in place to have a relevant number of the member states having a national cancer control plan. But for the cardiovascular health plans, it's totally different. The European plan is not yet approved, but the member states, and a lot of them already have approved, adopted, or are in the process to adopt. So there is a clear movement, and was really catalyzed by all these activities around cancer. I would like maybe to follow up a bit with you, Jeliazko, on this, on how these European initiatives can help in reducing inequalities. You mentioned Romania, Bulgaria, Balkans country, but we experience the same type of inequalities between rural areas, urban areas, gender inequalities, education, socio-economic inequalities, and so on. Maybe if you have a comment on this, and of course I invite you, Penilla and Teresa, to contribute.
Thank you very much, Marius. Excellent question. Because the major downside of being new members to the European Union for our both countries is that we are far away from the level of cancer care was being established many years ago in western part of the Union. On the other hand, it's absolutely impossible for the national governments to beat these inequalities in Bulgaria and Romania, and only through general documents like European Beating Cancer Plan and the implementation plan of the Mission on Cancer, we could quickly move up the work, the initiatives, the activities for cancer and trying to beat up the inequalities. We easily, through collaborations with other countries, other member states, we easily can adopt successful stories, successful initiatives, like even Penilla mentioned establishing a national cancer mission hub in Bulgaria, and through this hub, all the initiatives from Europe easily to penetrate the local healthcare initiatives here in Bulgaria and Romania. Indeed, inequalities are great in our both countries, and rural areas, if I may say, they're even more rural than rural areas in Sweden or in France or in Germany. So we have a lot of more work to do for our patients and citizens living in rural areas, rather than people living in well-developed European countries. But through a common initiative, through synergies, through planning programs, comprehensive cancer centers, and other general initiatives as outlined in the both Beating Cancer Plan and Mission on Cancer, we will manage, we tackle these problems. Thank you.
Thank you. Penilla, Teresa, would you like to?
Yeah, sorry, please.
No, if I may, I think that the two key words that you have mentioned, one is definitely innovation, and the other one is awareness. And both are common words for cancer and for cardiovascular diseases. Yeah. So to raise awareness about the problem is extremely important, because currently, if you ask even general cardiologists, general oncologists, to list the cardiovascular risk factors, some or most of them forgot cancer as a cardiovascular risk factor. And that's why it's so difficult sometimes to detect cardiovascular problems in cancer survivors, and why most of the time the cardiovascular problems in cancer survivors are detected at a later stage. Because, of course, during cancer treatment, the patient is, let's say, more organized in their cardiovascular and oncology health issues at the hospital. So awareness is really key. And innovation is extremely important, because we need to learn more about the mechanism that connect cancer and cardiovascular diseases to be able to implement effective preventive strategies. And innovation is not only on the mechanism, it's only on the strategies to prevent both diseases, because primordial prevention for cardiovascular diseases and cancer are exactly the same strategies. Mm-hmm. So we don't need to invest on prevent one disease. We need to invest and to innovate and to create innovative strategies to improve the global health, not to focus on preventing cancer or preventing cardiovascular diseases. And indeed, global health is now the main topic for the next European Society of Cardiology meeting in Madrid in 2025, because we really need to stop to work in silos and to drive all this innovation, awareness, and innovative strategies. We need to be able to implement in citizens, in patients, regardless of what is the main problem, because we are going to help them and we are going to improve their outcomes all at the same time.
Great, Penilla.
Yeah, I think to see also what's going on at the European level with the NCDs, non-communicable diseases overall, the prioritized areas, and many of those areas are chronic diseases. I mean, it's chronic diseases for people who are also getting older. We have an older population in every country. We have lack of staff in healthcare, etc., etc. We need to figure out how to still have some kind of basic good healthcare in every country. And I think, and I do hope that, working at the European level with the different health issues, with the EU for Health programs, and also these prioritized areas, not only cancer, but cardiovascular diseases and all the other related chronic diseases, will actually help the countries. I do believe that it could raise at least the basic level. And then we will still have, of course, inequalities depending on what kind of financing we have in each country. We cannot overlook and say it's not about money. Yes, it's about money, but I will also say that sometimes it's about leadership and organization as well. I mean, to implement innovative medicines or medtech is really one of the hardest things right now. We do have access to innovations, but to implement them in those healthcare systems is really, really tough. And if we talk about keeping life science industry in the European Union, I mean, how about if they leave, if the big companies actually are leaving the EU, I mean, how can we then prepare for any crisis, another pandemic, etc., etc.? So we really need to see the whole system, and each part is important. So whatever we can do where we are, I think it will matter.
Jeliazko.
I just raised my hand because I wanted to reflect what Teresa said. I'm really happy that contemporary cardiologists are paying so much attention on cancer patients who eventually might be cardiovascular patients as well. I just want to outline that nowadays, due to the innovative treatment, systemic treatment, radiotherapy equipment, medtech, as Penilla also mentioned, contemporary cancer patients live longer. They keep quite good quality of life, and being long survivors, they might experience they might experience toxicity of the innovative treatments, like, for example, immuno-oncology, immunotherapy treatment toxicity, which might be of cardiovascular origin. So it is really important that other specialists, medical specialists like cardiologists, endocrinologists, dermatologists, etc., are prepared, and they keep in the scope of their profession, of their specialty, keep an eye on patients who've been treated with novel systemic treatment for cancer, like immune checkpoint inhibitors or targeted therapies. So I'm really happy that we have Teresa Fernández here, that she mentioned this, and she has this understanding which I was lacking from previous generation of cardiologists. And also, I was lacking the discussion for patients who were treated in the chemotherapy era 10, 15, 20 years ago. Thank you.
Yeah, you're right. Indeed, we need to learn a lot because new cardiovascular toxicities are completely different. But we have also learned that there is an opportunity for prevention. And as in all medicine areas, prevention is better than treat. So if we combine the cardiovascular and the oncology and hematology knowledge, we really can involve patients in their own healthcare, which is really key because as Penilla mentioned, of course, we need money, we need regulation, we need investment, but we also need leadership to drive this change and the opportunity to create some links between cancer plan, the cardiovascular plan at the European Union level is definitely a turning point to improve the global health of our patients. So we need to really take this opportunity to increase the awareness and to increase also the message that we need to work together in multidisciplinary teams and to incorporate patients and patients' perspective to all these strategies because we really need their inputs to be sure that we are working in the right direction. It's not only about progression-free survival. It's about numbers. This is, of course, extremely important, but the global experience of the patient is definitely what needs to inspire us to make this change in the way we afford different problems that they can experience through a cancer process or through a cardiovascular process.
Excellent. You raised the topic of leadership. It's so important, and you, Penilla, and Jeliazko, you mentioned the National Cancer Mission hubs. Maybe for our viewers, is good to say a few words about this. So the National Cancer Mission hubs will be part of the Cancer Mission governance, and in the ECOS project, it's a beautiful project. We are working now to define the National Cancer Mission hubs, structures, governance. We're discussing about distributed leadership, about the pentahelix model of stakeholder engagement, about impact models, and so on and so forth. And I think all these tools that will come out from ECOS project can be easily adapted to actually to basically to everything is on health system, healthcare sectors. This is very clear. And also I'm very happy because you, Teresa, you mentioned the key role of prevention is something we've discussed several times with Penilla, with Jeliazko in the frame of Cancer Mission, and the projects and cluster on prevention and early detection. Indeed, the risk factors are common for cancer and cardiovascular diseases. This is something we experience in one of our projects. We went to promote European Code Against Cancer, but actually from day one, we included the cardiovascular health dimension in our living lab, discussing about innovation. I think the living lab approach is something, again, that can be considered outside of the Cancer Mission as well. But this is a discussion I would very much like to continue maybe in another webinar, because today we have around 15 minutes to go, and the big topic, artificial intelligence and data. And of course, none of us is formally expert, I think, in AI, but we are all consumers, and we're all using AI from, I don't know, ChatGPT to Copilot to different apps who are using AI and so on. And I will start this discussion with you, Teresa, because you mentioned how important it is to identify cancer in the history of a person in order to identify the potential risk for cardiovascular diseases. And I was thinking, if the European health data space and registries and electronic health records would be implemented and doctors would be able to easily access this data and analytics about the data. So, and this risks to pop up, automatically about a person. I think this is an ideal scenario. And how do you actually see, looking into the future, of course, this area of data and AI, of course, in the European perspective?
Yeah, thank you. As you mentioned, I'm not an expert in AI, but definitely we are consumers, and we have already implemented AI protocols in our daily practice because there are a lot of automatic analysis of cardiac imaging that really help us to reduce the time we invest in scanning patients, in analyzing the cardiac imaging data. We also use AI to interpret ECGs. And if we are really able in the future to implement these new strategies that are under development that can gather all this information along with the clinical information, what we really need is these tools to create a risk pattern. So when a patient comes to us, say, according to all your health data, we need to focus on this strategy as the primary task to improve your global health. So, of course, this is not, at least in Spain, this is not easy to implement because if we really work on a virtual hospital and we are able to implement all these strategies to monitor patients, to early diagnose chronic diseases, we need to change also the way we spend our time at hospital because we need to protect time to receive all this data, and we need time to interpret this data and to discuss data with patients. This is, of course, there are a lot of innovative tools that can communicate patients and doctors, but at some point, we still need to have a personal conversation with patients or at least to educate patients on how to interpret the automatic analysis of their health data. So there is a lot of work, a lot of very interesting and amazing work that is definitely going to change medicine and to improve the patient's global health, definitely. But we really need to work together to feed this artificial intelligence program in the right way and with the right data.
Thank you. Penilla.
I think to use AI in healthcare, it's an amazing tool when it's used the right ways. I mean, for prediction, for example, and I do believe when it's handled, by healthcare professionals who can also interpret the results. What I'm more worried about is actually the consumers that would like to, they like to know everything about themselves and to predict their own, diagnosis. And if they might, have some kind of disease or condition within the next 20 years, and they buy these tests for quite high sums, I would say, and it costs a lot to do it. And I think more or less people will get scared instead of having it as a good prediction for, prevention or to prevent, cardiovascular diseases or whatever. So I think to use it wisely, and we had a report in Sweden by an organization called AI Sweden just the other day who said that the Swedish regions who are handling healthcare here, they could save enormous lot of money to use AI in different ways. And not the least, many people says that, okay, if you train also patients to be more active themselves, they can do a lot of self-monitoring. They don't need to be hospitalized. And just if they feel that healthcare will be there if they need it. So they can do a lot themselves, and they can send in the results, for a small device. They can take their own blood pressure or blood tests or whatever. So data can be used if it's only transferred the right way and to the right doctor or nurse that can take care of the results, and also to bring the message back to the patient and say, okay, don't worry, it's fine. To handle patient data is really a big thing, I guess, in all countries. And we talk about primary use or secondary use. And of course, I think the patient data should be owned by ourselves. But also that it should only be used on a condition that I know that it will be safe, and it should be able to be transferred, to the right caregivers I'm in contact with, and so on. So to use AI and patient data, I think we cannot be without it. We cannot work without it. But it's more or less how it's used and how it's handled. And I think the digital maturity in countries are very unequal so far. So, and also the information, how it will be used. I mean, many countries do have an app in their phones. They can see also the patient data. I mean, I was just recently to my doctor at the healthcare center. I could immediately see the blood test result and so on. But it differs between countries and even between regions. And that's I think the most basic data you can see as a patient and understand. But if it gets more difficult or more advanced, of course, you need to have also regulations that says how it should be used and how it should be informed also to the patients. So it's not easy, but I do welcome the advancement of using AI and patient data if it can also be beneficial for the citizens and the patients, of course.
You, Penilla, you actually started our today conversation saying that health is a national competency, and this is true. When it comes to AI and data and so on, it's clear that this should be regulated at European level. This is very clear in order to protect actually us as a citizen. And you give a very good example with direct to consumer test, who should be regulated and used in the right manner in order not to harm but to help help people. This is a great point, and this shows the value of the European Health Union. Jeliazko, any comment on AI, data, inequalities?
Well, thank you, Marius. A lot been said by the previous speakers. Well, I'm also not an expert in AI. I'm just a simple consumer of the general features of AI currently. Well, because the discussion whether AI will be used in healthcare, in cancer in particular, or in general, has been held for a couple of years now. I always refer to example I give in such discussions about, for example, calculators. I mean, calculators, digital calculators, electronic calculators being invented, introduced to the public almost 80 years ago. And I remember, I'm not 80 years old, but I even remember during my childhood, as a pupil, I was banned. I was not allowed to use electronic calculators. I was taught and forced to mentally calculate. Nowadays, no student, no pupil, a school child is asking himself a question: should he or she use calculators or not? If I may refer to the artificial intelligence, probably the newer generations, the generations which are coming after us, would never ask whether it's worth introducing AI to cancer, to oncology, to different systems, patient dossiers, patient data, and etc. I personally strongly believe in innovations, and innovations are artificial intelligence is innovation. Whether it's the biggest one, I don't know. Whether it will be the next Blu-ray, because nobody speaks about Blu-ray DVDs nowadays.
Yeah.
Whether it will be just a VHS technology, we almost forgot about it, or remember with nostalgia. I don't know. But artificial intelligence is here and we use it every day. We have to learn how to use it for our benefit, for our for benefit of our patients, for benefit of our colleagues. If it brings us more time for relaxation, more time for reading, more time for producing science and etc., then it's good. If it's good for our patients, for our work, then it's good. But time will show whether artificial intelligence will remain, will survive or not. Thank you.
Hopefully, the AI-based algorithms of YouTube and Facebook and X and LinkedIn, where we'll post this webinar, will help us actually to spread the word and our messages in our today webinar to be sent to as many people as possible, because I think our discussion was so rich and so inspiring. Hopefully, I don't know, kids in 30, 50 years will not look to this webinar as we're looking to Jurassic Park, hopefully. But they will probably perceive us like people who came this afternoon together to discuss about the European Health Union, about the two main diseases, cancer and cardiovascular health, and how we can best innovate for the benefit of us, citizen patients, healthcare professionals, and all the people involved in the healthcare sector. I would like to thank you so much, Penilla, Teresa, and Jeliazko, for this discussion. I'm sure that is just the beginning of this cross conversation on cancer and cardiovascular health. I'm sure that will follow up on primary prevention, on multiple long-term condition management, and of course on the cardio-oncology management of the side effects in the months to come. Thank you once again for your participation, and have a great day. And thank you to all the people who
thank you so much.
Thank you.
Thank you, Marius. Thank you, Teresa and Penilla. Hope to see you again very soon.